Who has to have a license in this state?
Well, anybody who practices medicine of any kind has to have a license, and the license is granted by this is a state function, but it's farmed out to specific boards and commissions that the state appoints, and so they're appointed of people who practice that kind of medicine by the state. And then they get to say whether their friends or other people get to be able to practice. So it's people who already do the work who are then deciding how many more people they want to allow to join them and what standards those new people have to meet.
Now, I would say that most folks would hear you say that and say, you know what, I kind of want some sort of standard for people who are telling me that I've got something wrong with me and I maybe need to have some sort of surgery. So what is your specific concern then about the licensing process? Is it licensing itself or who does it?
Well, there's a little bit of both in this case with healthcare, because while seeing somebody with a license is reassuring and it's, oh, great, you see, just like you see the degree on the wall and you say, oh, wonderful, he was trained or she was trained at that good school.
A level of credibility and expertise.
Right. The problem is that when taking a look at places where there has been licensing versus lower levels of certification, and taking a look at practices that currently aren't licensed, like midwives, versus people that are licensed, there's not a lot of difference in terms of quality. There's a little difference in terms of liability, malpractice insurance, malpractice lawsuits. So you're not gaining much, if anything, by having licensure. And a lot of times all licensure does is it limits the number of people who can provide the service, which means that more people end up doing work on their own.